My first presentation this evening is essentially to tell you a little bit, just a short bit of background about Foundation Trust. Many of you may know already what a Foundation Trust is and the benefits, but I want to take you just through some comments about that and also the specifics around the coalition's government's approach to Foundation Trust status for organisations. So, Foundation Trusts were a policy direction of the previous government. The first organisations were licensed in 2004, and predominantly the objective of developing the policy of Foundation Trust was really to raise the standards of services provided by hospitals in England. And the particular areas of focus were around quality, performance, patient experience, patient outcome, and financial management. And the organisation that is responsible for authorising new Foundation Trusts is an organisation known as Monitor. It is independent of the NHS. It has a reporting line through to the Treasury, and is the overseer of Foundation Trust applicants to ensure that the applications meet a particular standard. And also is currently responsible for the continuing licensing of existing Foundation Trusts. Now, the White Paper sets out an increased range of powers for Monitor, but the situation as it is very much their responsibility is to authorise new applicants and then to monitor performance. Now, what are the benefits of a Foundation Trust? Well, as I said, the organisations need to attain a certain standard. So they need to be exemplary in terms of service delivery. They need to have very strong governance arrangements, which I'll come back to, and they also need to have a strong financial plan, which I'll come back to. But one of the main benefits for you as users of hospital service, potentially now or in the future or perhaps in the past, but also as the local population around a hospital, is that Foundation Trusts are more accountable to their local population than your bog standard NHS trust, in that one of the main components of the governance of a Foundation Trust is that it has a board of governors made up of local residents, and also has a membership. The expectation is that the membership is of several thousand people, partly made up from your staff, an organisation's staff, but predominantly made up from the local population who have the opportunity to have a say in the way in which the organisation uses its resources, develops its services, and makes sure that the services respond to patient needs. So that's one of the main dimensions for the changes in governance around Foundation Trusts. So, as I said, there has an elected board of governors, and one of the other main components of a Foundation Trust is that it has greater freedom. So it can reinvest its surpluses that it makes in its own service improvement, and has greater degree of control over how it uses its overall resources. One of the final points on that slide is that it also has the opportunity, unlike NHS Trust, to borrow money from the bank, which it can use to the betterment of its services. So the current direction set out in the White Paper is that all NHS trusts in England need to become or be part of a Foundation Trust by the 1st of April 2014. Now, that may seem like a long way away, but in reality, to be able to put an application in, the process of review by the Strategic Health Authorities, the Department of Health, and ultimately by a monitor takes about 12 months on average. So in reality, you really need to get yourself in a position as an organisation by the 1st of April 2013 to submit a credible application in order to be assured of meeting the deadline that's been set by the government. And as it says there, it's not easy to become a Foundation Trust. There are still 120 trusts nationally that are not yet Foundation Trusts. There are 26 in London, and of course Epsom and St Helier as a trust is considered a London trust, but there's also a Surrey Trust that is not yet a foundation trust, and as you know, that's the Surrey and Sussex Hospital. So the expectations of Monitor can be encapsulated in three key ways, and one of them we'll touch on in some detail fairly shortly. But the three main components are around performance, so consistently delivering on the national targets, but also having demonstrably good quality of outcomes for patients and strong patient experience. That's encapsulated in the performance component. And it needs to be demonstrably, and not just 1 year, but a track record of delivery over previous years. The second main component is the extent to which you govern the organisation. How well is the organisation governed? Does it have a strong board of governors? Does it have a strong board of non-executives? But also, how does it manage risk? How does it manage financial and clinical risk? But also, how does it use its resources? Does it make best use and deliver services to the best value for money for its patients? Now, this trust has done well on those two components and has a reasonably strong track record. Some areas for improvement. We can always improve on our patient experience scores. We can always improve on our hospital-acquired infection scores. But over the last 3 years, performance has been relatively strong in these areas, and certainly with a further push could have achieved Foundation Trust status on those indicators. The third one, though, is where we have the particular challenges, and Andrew will come on to that in more detail shortly. So as I said, 26 trusts in London, a significant number of organisations that will still need to go through a process of developing a credible plan to demonstrate to Monitor that it meets the standards predominantly across performance, governance and finance.